I'm here with County Commission Chair Brenda Howerton to announce a new emergency order for Durham County and City adopted by myself and Chair Howerton over the weekend. This order requires face coverings to be worn indoors in public places, businesses or other establishment. It takes effect tonight at 5 o'clock. I know it's not fun to wear face masks. None of us, not something that any of us enjoys. But we know from our own experience in Durham how effective face masks can be for limiting the transmission of the virus. Face masks are a common sense, non-economically damaging way of limiting transmission. If we want to keep our economy open, if we want to keep gathering together, as we are able to do now in public settings, we've got to wear face masks to limit the spread of the virus in Durham County. Both the Centers for the Disease Control and the Department of Health and Human Services recommend indoor masking. We're following those guidelines. And this is for all people, including those who are vaccinated, to wear masks in indoor spaces when you're around people you do not live with to contain the spread of the virus. In addition, in deciding to issue this order, Chair Howerton and I met last week with our public health director, with the doctors from Duke Health, and they also unanimously endorsed this guideline for our city. As you all know, the Delta variant is rampant in our nation now and in Durham as well. It's twice as transmissible as the Alpha variant, which we have been dealing with for a long time. It has more of a viral load. It's much easier, in other words, to catch the Delta virus, and it's worse for you when you do catch it. While there are a few breakthrough cases among those who are hospitalized, I do want to make one thing very, very clear. And we heard this from our public health director. We've heard this from Andy Cohen, the State Secretary of Department of Health and Human Services. The pandemic we are experiencing now is a pandemic of the unvaccinated. More than 90% of the cases and of the serious cases are among those people who are unvaccinated. This virus and the Delta virus know no political boundaries. If you are unvaccinated, I just want to say this really clearly, if you are unvaccinated, the chances are good that the virus will find you. If you are vaccinated, your chances of getting sick are much, much lower than those who are unvaccinated. But even vaccinated people without symptoms can transmit to those who are vaccinated. And that is why the indoor mask mandate applies to everyone, vaccinated or unvaccinated. We are working together to keep each other safe. I do want to talk briefly about what the situation is in Durham now with COVID-19. We are in a much more serious situation with the virus than we were just a few weeks ago. 2 weeks ago, you know, the State Department of Health and Human Services, and you look at the CDC guidelines, the CDC had our transmission at moderate. We have now gone from moderate to substantial, and now we're at a high level of transmission. This is true of Wake County now, it is true of Orange County, and if you look at the map, the CDC map, almost every county in North Carolina now has a high level of transmission. Things have changed. Just a month ago, we were down to fewer than 5 cases of COVID in the Duke Health system. Fewer than 5 cases. That was a month ago. A week ago, we were at 56 cases. I'm telling people this to help you understand the seriousness of this. It's very, very serious. There is a lot of good news, too. I'm happy to report that more than 200,000 people in Durham have now been vaccinated with at least one of the vaccines. That is more than 62% of our residents and more than 72% of our residents over the age of 12 who are eligible. More than 72% of our residents, according to the CDC page this morning, have been who are eligible for vaccination have been vaccinated. This is great. We still lag a little behind both Wake and Orange counties, but we are among the leading counties in the state and in the South when it comes to vaccinations. We still have 12% of our residents over 65 who have not yet been vaccinated, and we need to make sure that all of our residents over 65 who are vaccinated. And there are still 120,000 residents of Durham County without a vaccine, and that includes all children under 12, of course. So we are eagerly await the moment when we are able to vaccinate our people, young people under 12, and that's not too far away. I know, and Chair Howard and I discussed this with our public health folks, that our residents in Durham are ready to accept this masking mandate. I was in Food Lion yesterday. Everybody was masked up. Every store I go into, the great majority of people are masked up, and we need to continue that in Durham. But I called our largest mall, of course, is South Point. I called the manager of South Point Mall on Friday to let him know we were coming with this mandate. They're totally ready. You all know that Amazon has announced a mask mandate for all of its employees. You know that Tyson Foods, a chicken packer, has announced that all 120,000 of its employees will be wearing masks. Duke University and Health System has an indoor mask mandate. This is something that is common sense. It's being done throughout our society, and it needs to be done here in our community. So the key to beating the virus remains vaccinations. We're doing everything in our power in Durham to get more and more people vaccinated. As I said, we eagerly await the time when our 12-year-olds can be vaccinated. In the meantime, as long as the Delta variant is raging, we need to be masking up indoors. Chair Howerton has to leave early, but she has kindly agreed to come today and say a few words as well. Chair Howerton.
Thank you, Mayor. So good morning, everybody. And I do have to jet in a second, but I wanted to be here on behalf of the county so that you know that it's the county and the city, that we are here to say that we support the citizens of Durham to make sure that they are masked up, that they are making sure that they get the vaccine, that they are vaccinated. And our mayor has given you all the facts, and I just want to be here in support that this is something that we just feel that's necessary. And I was at a conference this week, last week, for a few days, and I was in an area, and the only people that were wearing masks were the ones that were at the conference. People that were coming in and out of the hotel were not wearing masks. And if you get on an elevator and people don't have a mask, get off. Because that's exactly what I did. When people got on the elevator and didn't have masks, I stepped off and took the next elevator. Because this is serious. And if it's not serious for you, think about it being serious for your family. Because we're hearing about people in other areas that the whole family's in the hospital. So just what I would just like to say to the community is continue to mask up, to continue to take care of your family, because that's how important this is. So I'm going to jet and get to my next appointment, but thank you all for being here.
Thank you, Brenda.
Okay, you're welcome.
Thank you. Appreciate it very much.
All right, talk to you later.
Yeah.
Bye-bye.
Thanks to Chair Howerton, and now I'm happy to take any questions that you might have.
Mayor, could you talk about if you're considering instituting a vaccine mandate for city employees?
So the city manager and I have discussed that. As you know, there are more and more both private and public institutions that are going to either a vaccine mandate or weekly testing, and we are considering that.
And do you have a message for Durham business owners? Would you like to see more Durham companies requiring vaccines?
I think that we have a lot of our companies that are requiring vaccines. I'll just give you one example. DPAC now has all of its 300 employees vaccinated, and there are many others that are, and I think that I would definitely encourage that for sure. Vaccinations is what will keep us safe. Kristen?
More about how this mask mandate will be enforced?
Sure. Well, you all remember that Durham was the first city in the state at the beginning of the pandemic to have a mask mandate. And I will say that we had to do very little enforcement because people generally comply. There are exceptions, we know that, And we try to enforce with a light touch. We start, our city attorney will write a letter to anyone who we understand not to be enforcing the mask mandate, and usually that gets the compliance that we need. If necessary, we can send a police officer, and sometimes a sheriff's deputy will go, depending upon where it is, to talk to the business and to ask them to get compliance. These things usually work well. If we have to go further than that, we do have the power to cite someone. There's the power for a citation. But we've had to do very little of that in Durham at the first mask mandate, and I expect that will be the situation now. We really need voluntary compliance, and that's what we get. So if we have to, Crystal, we do have those means at our disposal, but it's our strong hope that there will only be, we know there'll be a few people that try to defy the mandate, but there'll be very, very few.
Like a few businesses?
Yeah, there might be a few. There always are, but most businesses we have found very compliant. I mean, most businesses are already doing this. I was just at, this morning I was at Cocoa Cinnamon. They have a sign on their door, mask up when you come in. I was at the Regulator bookstore yesterday. Mask up when you come in. I mean, I think this is the routine. You all know this. You live in Durham. You know what it's like. The whole triangle's like this. People are pretty much masked up when they go inside anyway, now that the Delta variant has come. But yes, if we need to enforce, we can.
Mayor, have you given
Tim?
yourself a timetable or time frame to revisit this, to see if you'll lift this, or is there a metric that you're looking at?
That's a great question. We don't have a time frame written into the order, but we will be evaluating this, every week, every 2 weeks, to see when it's no longer necessary. I mean, we all look forward to the day, and I really thought we were heading that way until the Delta variant hit, where we would not be needing to do any of these things. In a way, we're kind of back to the basics, the social distancing, the hand washing, the masking, and the vaccines. And it's just a fact of life with the Delta variant and with the increasing infection rate in our community, the increasing number of people in the hospital and in the ICU, that we have to go back to masking. We will be checking on it. We will be monitoring it weekly. And as soon as we feel like we can safely lift the order, we certainly will. No one wants to do it. I can tell you, as the mayor of Durham, this is not something that I want to do. This is something we need to do.
Will the city actively be going out to make sure businesses are complying?
No, we'll only do that. We don't feel the need to. We know there's so much compliance. If what we will do is sometimes there's people will complain. People will write us and say a certain business is not complying and that kind of thing. When that happens, we check into it. Yeah, that's what drives the any compliance.
Are there any other tools or measures that you are considering of taking this a step further as far as any COVID guidelines and public health routines?
I will tell you just a little bit about the work we're doing. I think that this is important. One of the things that we know about the level of vaccines in our community is that vaccines are inequitably distributed. That when you look at the population in Durham, and this is nationally, it's actually an international problem, but just thinking about here in Durham, our white population is vaccinated at a substantially higher level than our black and brown populations, especially our African American population. And so we feel that there are a couple of reasons for this. One is access. Our African American population and our Latinx population tend to have less access. It might be that people need child care to go get their vaccine. It may mean that people are more likely to be homebound without a car, good transportation, these kinds of things. So there's an access issue, and there's also a trust issue. We know that our communities of color are less likely to trust the health system, and so we have to try to overcome both of those things to increase vaccine equity. And as we increase vaccine equity, we increase vaccine uptake for our whole community and the safety of our whole community. So the county and the city together have allocated $1.3 million. We have hired 45 community health workers. They're based in 9 community-based organizations that have experience with community health workers to go out and to help build trust and to increase access for people. Do people need rides? Do all those things that can help people get to vaccines? So that's not a restriction, but I think it's an important action that we're taking that we believe and we know will help increasing vaccine uptake. And we're seeing our vaccines go up. If you look at the CDC chart, if you all are looking for this, I think one of the best places to look is at the CDC, where you see the CDC COVID vaccination pages, and you can look by county. And I look every couple days. I look at Durham County, and we're a couple days ago for our 18 and above, we were at 71%. Now we're at 73%. We continue to go up, and our health department is having community events constantly. We had 3 this past weekend. Our county public health department did, and so we're continuing to actively vaccinate, and I feel like we will continue to increase.
Yeah, sure. You had, at one point, the vaccination rate was moving steadily and actually doing quite well, and then we've seen this sort of market decline. What do you attribute that?
I think that there are a couple things about that, Thomas. I think that that's not just a Durham phenomenon, but again a national phenomenon, and that the reasons for it are, I think, that everybody that had a high level of access and a high level of trust in the system rushed to get their vaccine. That would include me. As soon as I was eligible for a vaccine, I got a call from my doctor's office. They had 100 vaccines. They were part of the distribution network. I had a high level of trust and a high level of access. I got my vaccine. And I think that once we got to a point where all of those people were vaccinated, who had a high level of trust and a high level of access, the number of people getting vaccines dropped off. And so now we have to do the work one by one. Trusted messengers like these community health workers, like pastors, like family members, like friends, to help people both trust the system and get access to it. Any other questions? Let me just see if I had any other things I wanted to mention. I do want to mention one other thing, and I hope that you all will help with this. For people that just don't know how to schedule a vaccine, you can schedule a vaccine at the county health department, and there's one number that you can call, 919-560-9217. 919-560-9217. That's to schedule a vaccine at the county health department. If you want to schedule a vaccine at Walgreens or many of the other possible places, you can simply do that by going to the county health department website, and they will tell you how, or by going to Walgreens website or CVS website. There are lots of ways to get vaccinations in Durham, and so I hope you all will spread the word. Thank you. I appreciate y'all being here today on such short notice. I'm very grateful. Thank you a lot.